So where we have an individual who has pain in an AP direction, so a forwards and back or antero-posterior direction, an AP glide can help, and then we can follow that up with a home exercise technique. Now traditionally when we perform this, we flex the knee 90 degrees, we sit on the patient's foot so that the foot doesn't slide, and then I can press inwards in this direction to perform my AP glide, or I can pull outwards in this direction to form my PA glide. However, that's a little bit uncomfortable sometimes for the patient, and it's quite hard for the therapist. So an alternative is to use a block. And if I am moving the tibia downwards, then I place the block under the femur with the front edge level with the joint line. So we've got less flexion now, and traditionally the force is imposed by putting the heel of the hand over the shin with the thumbs over the tibial tuberosity, and that is effective. However, if you're an 8-stone therapist and you've got a 19-stone rugby player, that's going to be very tiring on your hands. So an alternative is to use the edge of your hand. So we're using a V shape on the tibia, but I'm not going to be placing the force with my hand. So I'm not gripping using my fingers, I'm using my other hand to rest on top. This one creates the force with my body weight. So I'm standing on my tiptoes, and then all I do is press down. So I'm dropping my body weight to create the force. The force is then transmitted through my straight arms to the tibia. So that is a glide of the tibia on the femur, and we can reverse that so that we position the block on the tibia, and then I'm doing the glide of the femur on the fixed tibia. So I'm coming down into this position. And these techniques can be useful where the individual finds it difficult to get those last few degrees of extension, either where they've got blocked extension or where they have an extensor lag. So when they lift their leg trying to keep it straight, the tibia just drops down a little. So the first technique is performed at 90 degrees when we're sitting on the couch. This one is performed in virtually full extension. So that's an AP glide on the knee joint itself.